Abdul from Hare Hills. How does it feel for me? February 2025. Can you share an update of your experience of your cancer treatment?
I've been going to St. James's, which is the radiotherapy department. It has been very scary at the beginning because the word cancer itself is a very scary word. There was a time when I was supposed to have a telephone consultation with the radiotherapist. But then they sent me this text to say that a sheet where they recorded all the days that I'm going to for the therapy treatment. And one of the days, Tuesday or Wednesday, and I was supposed to be there for 9 o'clock, only to get there and find out that that 9 o'clock appointment was actually a telephone appointment, not with the doctor. And the receptionist had to find out. They had to rearrange the session for my radiotherapy, which was actually supposed to be at 2:25 in the afternoon. So anyway, I was seen that day. I normally go to the machine number 5. That day I was sent to the machine number 4 because they had to rearrange my session. My GP says they are going to continue with the necessary injections and things that you're going to be doing.
How did the experience in urology mentioned make you feel?
We went very early with no breakfast, just with wanting to be there, my wife and I, and it was not very comfortable. However, I got to be seen around 12 o'clock and so on, which was okay, early enough. I think the communication should have been more precise, especially when the patient is disabled as I am. And I'm not asking them to provide transportation for me. I prefer to try and come into the hospital.
How did the response to your situation make you feel about the care you received?
I value the fact that how what was going to happen to me if I had to wait there after being seen by the doctor, wait there until 2 o'clock to be seen. They were very uncomfortable really when they saw that, because they had to consult 2 or 3 people until they got to this doctor who was supposed to see me, and he agreed to change something else that he was going to do. They felt very embarrassed that they didn't have the record. At the beginning, they insisted that I was supposed to come that morning. I said, well, so which machine am I going to? Then they checked to find that I was not supposed to go to radiotherapy that morning, but that afternoon. That was how they managed to switch things around and try to get me in earlier, which I valued very much. I felt that they cared for me, and they thought they shouldn't allow me to suffer unnecessarily.
How does the communication between your GP and the urology department impact your understanding of your medical treatment?
They used to send me text messages, which is okay, but then actually being explained to in person. The urology department used to do that, but after some time, they told me to call them whenever I needed to do something. But apparently, the specialist nurses may be too busy. I used to call and not get through to anybody. So one day, I went in and they told me to just wait, that the radiotherapy department will communicate with me, which I waited. Eventually, that was happening. That happened. I get the letters from the GP, which is a copy to me from the urology. And then when I go in to see the GP, they find out, they ask me whether I'd got the letter. The letter tells me what to do, where to go, and so on. My GP, normally, this surgery, will normally send me a text message to tell me that I need to go in or I need to go and see them. But rarely the urology does communicate with me by letter. Well, I think it would have been better if the communication was coming from my GP, because I'm more in contact with the GP than with the urology department. I would have thought if they get any information for me, it's my GP who will call me in and tell me, and not just a letter, which is okay. You see, like the agreement, when I agreed to do the radiotherapy, it was a letter that came to me. I didn't know exactly what was happening until I went in to see my GP, that I saw, they explained the letter.
What one thing would you have changed about your care in the last few months?
The communication and the people, the receptionists or the secretaries who are communicating with the patients, do direct communication with the patients. I know all this is put into computer, internet, and things, and they send them off to us. But then, if if it is checked with the patient the day before the appointment, that will be better. Then the patient will be ready. I don't think there'll be any mistake. If it is a text to say, look, Mr. Jello, you have an appointment tomorrow morning at this time, or we're going to give you a call at this time. But that was not done. It was only written on the sheet that was the appointment sheet for me. The specialist doctors, radiotherapists, urologists, and so on speak to me, the patient. But then me, I am almost half disabled, and most of the time it's my wife who does the giving me the medicines and the care. I think if the information that I'm given is also given to my wife and they speak to her, I think it will be better, because she being the carer, she knows more. Sometimes I forget to take my medicines and she reminds me, have you taken this? Have you taken that? She does what I tell her. I am not a specialist, I am the patient. They can talk to both of us, but at the same time, if she knows what I'm supposed to do, she'll be able to explain it to me better, especially in terms of local language which we use. If more communication is done between the patient and the patient carer, it will make a big difference for the patient as well as the hospital. Then certain things will not have to be referred to the hospital or the GP directly. The carer will take care of that.
What aspects of your care have you valued the most in the last few months?
When you are told that you have this disease, but then they tell you that we are going to try and treat that disease, it makes the patient become less afraid, which is what happened in my case when I was told about this cancer, which I was not very sure of. But when they explained it to me, I found that cancer is not as dangerous as everybody thinks it is, as I thought before. And and then the treatment, the care, the people I spoke to, the people who spoke to me about it, and then the treatments that I was prescribed to do. And all that has been a very big experience and a very useful experience. And so far, from the time I started taking these treatments to now, I do feel better, in terms of my body, in terms of my way of thinking, being able to do certain things that I was at the beginning not sure I would be able to do, in terms of worship and so on. And that is something that is really valuable to me. Whenever I cannot, do those things, my religion especially, I find that I'm losing. And that is something I don't want to do. If I can do those things, I can do my religious activities, then I feel I'm okay. People don't live that long unless they are doing things that is keeping them alive.
What message would you like to share with healthcare professionals and others going through similar experiences?
The people who are doing this work, the nurses, the doctors, especially the new nurses that are joining the system, they should feel confident that they are saving lives and that they are doing the type of work that is destined for them. You know, some people go into this carer work, nurse work, and so on. Then after a while, they find it boring. But I tell you, it's the kind of work that you do and you feel comfortable because you are saving other people's lives, just like your own life. The care that people put into saving other people's lives is a very great thing.
Thank you to Abdul for sharing his experiences. Produced by HealthWatch Leeds in collaboration with Ro Lara.